definitely encourage people to reach out to this panel to learn more about how we can collaborate, how we can start to bridge that gap that exists between the prepared workforce and the workforce that exists, and hopefully come to a place where we meet in the middle somewhere a bit closer to where we are now. So thank you guys again. We're going to close this session. It's the last panel of the day. For those that are online, apologies that we didn't have time to get to the question, but we can definitely follow up. I've got the question was around public resources to help build digital health literacy. So we can certainly follow up. If you're online, the Zoom poll survey will be up in front of you right now. I'm sure, again, evaluations are really key for us. We are now sort of at the tail end of the day. So I'll ask our panel, you guys are excused from the front of the room. Thank you so much. It's been a pleasure getting to know each of you, and we certainly will be in touch. I'm just going to make sure, I think we're going to be switching over just to make sure our online audience is with us. So I'm just going to pause for a moment, double check with my tech team to make sure that we are good to go. Looks like we are ready to go. So we're going to, as we're just setting up the front of the room, thank you so much. Let me move that for you so we don't spill anything. Now's the time of the day that we get to announce the winner of the student posters. And so to do that, want to introduce Beth Payne to all of you, who will be announcing our winner. Beth is the Digital Health Research Program Manager at BC Children's Hospital Research Institute and the Women's Health Research Institute. Beth brings together 15 years of research and leadership experience in the fields of global health and digital health, primarily focused on maternal and child health. So I'm going to pass it straight over to Beth.
Thanks, Tina. And thank you all for sticking around to the very end of this really amazing day. I just wanted to, since we are getting close to the end, give kudos to Tina really quickly, who has led us through the whole day. So yeah, thank you, Tina. It's my great pleasure to be here to talk about the Student Poster Prize. We've had a student research competition for the last couple of years as we did these events under Digital Health Week, and now for the BC Digital Health Forum, we've expanded the poster competition to include beyond just the Children's and Women's Hospital students. And so hopefully you all got to see the wonderful posters that we've had this year and appreciate the breadth of work that's happening across the province at our various academic institutions. Each year we have an external review committee that comes together that includes both patient partners as well as experts in the field from computer science, engineering, health informatics, healthcare, clinicians, kind of echoing the breadth of care capacities and different skills that go into this field. And this year again, each of our applicants for the Student Poster Prize was reviewed by at least 3 external reviewers, and our winner was the highest ranked of all of the posters. And so without further ado, because it's my great pleasure to announce the winner, Miss Haneen Amhaz, come up here. Haneen is a Master's of Public Health student at Simon Fraser University, and I'm going to hand the mic over to Haneen now.
Thank you, Beth. Good afternoon, everyone. I'll just wait until my slide goes up. Yeah, so it's a pleasure to be here to share the project I've been working on with all of you. And so the title of the project is RAPID, which stands for Research Agenda for Perinatal Innovation and Digital Health. And so our goal was to bring together key partners to co-develop a research agenda for digital health innovation in perinatal health. And so we had three main objectives. The first was defining what the barriers and facilitators are for adopting digital health from both the patient and care provider and health system perspectives. And we also wanted to identify what the gaps um, in perinatal care are that can be addressed with digital health innovation. And lastly, we wanted to build on all these findings to identify research priorities and co-develop research questions that can motivate future digital health innovation. And so we did this through a series of activities, the first being a literature review to identify the barriers and facilitators to perinatal digital health implementation that are known within the existing literature. And then we also reviewed the BC Digital Health Strategy Report that was talked about earlier this morning. And we also reviewed Perinatal Services BC's Maternal Services Strategy Report. And we just looked for any relevant gaps and priorities that they themselves had identified. And then we engaged with care providers through a thought exchange, which you all also had the experience of doing. And so we used that to identify what tools care providers were using and how they felt they were working or weren't working to their advantage, as well as like what opportunities they saw for digital health to intervene. And then this was followed with our patient engagement meetings to gain a deeper understanding of perinatal patient experiences. And then we concluded with a workshop to brainstorm and align on the future direction of perinatal digital health innovation. And so I'll go into more detail into our patient engagement meetings and our workshop. And so to do that, we used a human-centered design approach. And so this approach allows us to build on the real needs, wants, and pain points of perinatal patients in order to develop solutions that are feasible, viable, and desirable. And so within our case, it allowed us to center perinatal patients within our project and really focus on them as a whole person, considering all aspects of their experiences, so their situations, their ethnographic, and their physical environments. And this also creates a shift from patients being subjects of research to instead being partners in research. And it also shifts from us making assumptions on what we think we know about patients to actually focusing in on highlighting their real life experiences. And so it's a little tiny, but there's a little table in the middle, and that's an overview of our patient engagement meetings. And so we had 4 patient partners and we had four meetings, and these were held over Zoom just to accommodate our patients because some were new parents and also they were coming from various cities around the lower mainland. So coming out to Vancouver to us wasn't really feasible. And so each of those meetings had a different objective, but overall the goal was to have patients reflect and break down uh, their needs, experiences, and perspectives, also looking at their pain points uh, and any opportunities for improvement within the current healthcare system. And so their reflections were facilitated with those human-centered design activities, and this generated a lot of insight from our patients that we then incorporated into our workshop. And so our workshop brought our insights from the patient engagement meetings and all the other activities that we had done. And it was a 90-minute virtual workshop, and it brought together our patients, care providers, health systems partners, and other researchers. And it was we had breakout room discussions, and it was all about aligning on priorities within perinatal digital health innovation. And so the workshop concluded with uh, all the partners developing draft research questions for perinatal digital health. And then us as a research team, we took those draft research questions and using all the insights that we had, and also with meeting with our patient partners, we refined those questions, and we had a total of 12 questions at the very end, and they fall under 3 different themes. The first theme of questions revolved around patient autonomy and support as they are navigating the healthcare system. The second theme focuses on accessible and reliable educational resources, not just for patients, but also providers. And lastly, theme 3 questions focused on patients' ability to access their health information across different settings and jurisdictions. And so our next steps is a call to action through the sharing of our findings and our research questions, as well as identifying researchers and different project teams who can take on and champion those research questions that we've developed. And so it might be easier on the poster, but we did develop a toolkit that outlines our patient engagement meeting and also has templates for all the activities we had for future digital health researchers to utilize. And there's also a QR code that takes you to our call to action and our research questions. It's also on the poster, which is easier to scan. And yeah, before I conclude, I do want to thank our patient partners and acknowledge that the project could not have been possible without their continued invaluable contributions. And yeah. Oh, and also we are presenting tomorrow at 1:30. So if you want to tune in, it'll be a more detailed overview of the project, and you'll also get an opportunity to hear from our patient partners. Thank you.